Your cat stops doing their usual thing and starts tracking you from room to room. They wait outside the bathroom. They settle against your chest at night. They stare when you stand up too fast. They climb onto you when you are trying to work, rest, or just breathe for a second. That sudden clinginess feels sweet, but sometimes it is your first clue that something in your body has changed before you have fully noticed it yourself. Your cat is not being dramatic. Your cat is not trying to annoy you. Your cat may be reacting to your smell, your temperature, your breathing, your heart rhythm, or the way your routine has quietly shifted. In the next few minutes, you are going to hear 7 health problems this behavior can sometimes line up with, and one of them catches people completely off guard. This is not superstition. In 2025, researchers from Tokyo University of Agriculture found that cats spent longer investigating the scent of unfamiliar humans than the scent of their owners, which tells you your cat is constantly sorting human odor in a very detailed way. Other research shows cats can also read human emotional signals and react differently to anger, fear, and calm. So when your cat suddenly refuses to leave your side, there may be a sensory reason behind it. BBC News PMC Avsob U are about to get the full list. From the most common and easiest to miss, all the way to number 7, which is the one that has led some owners to book an appointment they had been putting off for months. Stay with this, because the difference between a cute habit and a warning sign is usually what else your body is doing at the same time. Number 1. Migraine. Your cat may pick up on a migraine before you call it a migraine. Cats notice small changes in scent, mood, tension, and routine. If you move more slowly, squint at light, lie down earlier, or smell different because your stress chemistry shifts, your cat may stick closer than usual. Smell sensitivity is deeply tied to migraine, and that matters because your cat lives through the world of smell more than you do. The American Headache Society notes that smell sensitivity, called osmophobia, is common in migraine, and migraine experts say some people become unusually sensitive to odors before or during an attack. If your cat suddenly gets clingy on the same days you feel head pressure, nausea, neck pain, or light sensitivity, pay attention to that pattern. American Headache Society Migraine Disorders Watch for repeated headaches, needing a dark room, irritability, or feeling wiped out for no clear reason. Start a simple note on your phone with the date, your symptoms, and what your cat did. That one habit can help you spot a real pattern fast. Number 2. Obstructive sleep apnea. If your cat becomes intensely attached at night, especially around your head, neck, or chest, do not brush that off too quickly. Sleep apnea causes breathing to stop and start during sleep. Your cat may hear the silence, the gasp, the snore, or the sudden shift in breathing before you ever connect the dots. To a cat, that change is loud. The American Academy of Sleep Medicine says warning signs include loud snoring, choking or gasping during sleep, morning headaches, and heavy daytime sleepiness. There was even a widely shared report in Newsweek about 2 cats repeatedly waking their owner, who later learned they had sleep apnea. A veterinarian quoted in that story explained that cats may react to changes in breathing pattern and body chemistry. ASM Newsweek Watch for waking up exhausted, dry mouth, morning headaches, dozing off during the day, or a partner telling you that you snore or stop breathing. If that sounds familiar, ask your doctor about a sleep evaluation instead of waiting for it to get worse. Number 3. Hyperthyroidism. When your thyroid is overactive, your whole body speeds up. Your skin may feel warmer, you may sweat more, your heart may pound, you may feel edgy even when nothing is wrong. Your cat may respond to that extra heat, restlessness, and scent change by staying near you more often, almost like they are trying to monitor you. Mayo Clinic lists common hyperthyroidism symptoms as weight loss without trying, fast or irregular heartbeat, sweating, anxiety, tremor, heat intolerance, sleep problems, and warm, moist skin. A cat that keeps pressing against you, circling you, or refusing to settle when you are revved up may be noticing what your body is broadcasting. Mayo Clinic Watch for feeling too hot when everyone else feels fine, a racing heart, shaky hands, sudden weight loss, or new anxiety that feels physical more than emotional. The clear next step is simple: book a basic medical visit and ask for thyroid blood work. This is one of those problems that is easy to overlook and very treatable when caught. Number 4. Hypoglycemia, or unstable blood sugar, low blood sugar, changes the way you smell, move, and act. You may become pale, sweaty, shaky, confused, or strangely irritable. Your cat may react to those changes before you fully register what is happening, especially if these episodes happen around the same time of day. Some cats become clingy. Some start pawing, meowing, or following hard. Mayo Clinic says hypoglycemia symptoms can include shakiness, sweating, hunger, fast heartbeat, fatigue, irritability, dizziness, and confusion. Research into blood sugar and breath chemistry has also found that hypoglycemia can change volatile organic compounds in breath, which is just a technical way of saying your body releases a different scent signature when glucose drops. Mayo Clinic watch for crashes when you have skipped meals, exercised hard, or taken diabetes medication. If your cat suddenly becomes glued to you during those moments, check your blood sugar if you can, eat or drink fast-acting carbs if medically appropriate, and talk to your doctor if this keeps happening. If your cat has become your shadow and you have already recognized yourself in even one of these, do not click away now. The last three are the ones people ignore because they hope it is nothing. Number 5. Heart failure or serious heart rhythm problems cats are sensitive to movement, vibration, sound, and breathing changes. If your heart is struggling, your breathing may change before you think of it as a heart problem. You may breathe harder lying down. You may pause on the stairs. You may have swelling, fatigue, or an odd cough. Your cat may start staying close because your body no longer sounds or feels the same. Mayo Clinic lists heart failure symptoms that include shortness of breath with activity or when lying down, fatigue, swelling in the legs or feet, rapid or irregular heartbeat, wheezing, and sudden weight gain from fluid buildup. A cat that camps on your chest, watches your face while you sleep, or follows you during episodes of breathlessness may be reacting to those shifts. Mayo Clinic watch for getting winded doing normal things, needing extra pillows to sleep, swollen ankles, chest discomfort, or a heartbeat that feels wrong. If those are showing up, do not self-diagnose. Get medical care promptly, especially if breathing changes are new. Number 6. Epilepsy or seizure disorder. This is one of the most startling ones because the clinginess can happen before the event. Your cat may notice tiny changes in movement, smell, posture, or awareness in the minutes before a seizure. They may suddenly stare, vocalize, climb onto you, or refuse to leave you alone. That behavior can look random until you match it to what happens next. Mayo Clinic says some people experience aura symptoms before certain seizures, including stomach sensations, fear, déjà vu, strange smells, dizziness, or visual changes. And in a BBC reported case from Bournemouth, a cat named Lily was said to alert 19-year-old Nathan Cooper before seizures and even licked his mouth when he stopped breathing during one episode. Mayo Clinic BBC News watch for blackouts, staring spells, sudden confusion, waking with injuries, or anyone telling you that you zone out. If your cat repeatedly becomes frantic before those moments, tell a doctor exactly that. It may sound small, but details like timing matter. Number 7. Cancer. This is the hardest one to hear, so hear it carefully. Your cat cannot diagnose cancer, but cancer can change body odor, inflammation, pain patterns, fatigue, and the way you carry yourself. A bonded cat may lock onto those changes and become unusually attached, especially if the behavior is persistent and focused on one area of your body. Researchers have long studied disease-related volatile organic compounds, the scent chemicals that can shift in breath, sweat, and skin during illness, including cancer. Reviews on cancer detection note that these compounds can be different enough to study as possible biomarkers. That does not mean your cat is a medical test. It means your cat may notice that something about you is no longer normal. Oxford Academic PMC watch for unexplained weight loss, unusual fatigue, a new lump, persistent bloating, changes in appetite, bleeding that is not normal for you, or pain that stays. If your cat keeps fixating on you and your body has been whispering that something is off, stop waiting and get checked. In Minnesota, Kate King Scribbins noticed that her cat Augie had changed. He had always been affectionate, but now he kept pressing himself against the left side of her chest and snuggling there in a way that felt unusually determined. It kept happening. Not once, not twice, over and over. Then she woke up with sharp pain, checked herself, found a mass, and was later diagnosed with stage 3 breast cancer. After treatment, she said Augie stopped focusing on that spot the way he had before. Whether you call that instinct, scent, or one cat refusing to ignore what had changed, the point hits hard. Sometimes the animal who knows your normal best is the first one to react when your normal is gone. Daily pause so here is the fast recap. Migraine, sleep apnea, hyperthyroidism, low blood sugar, heart failure or rhythm trouble, seizure disorder, cancer. None of these are things your cat can diagnose. But sudden clinginess can be your signal to stop brushing off your own symptoms and look at the full picture. If this behavior has happened in your home, I want one very specific thing from you in the comments. What exactly does your cat do when they refuse to leave your side? And what was going on in your body when it happened? If someone you love has a cat who suddenly became extra attached, send them this video like a quiet little gift. It might help them pay attention to something they have been minimizing for too long. In the next video, you are going to see the strange sleeping spots cats choose when they are trying to comfort you, guard you, or tell you something is changing. Sometimes love sounds like purring, and sometimes it sounds like a warning.